In this video, we're going to talk about Botox for men, a new treatment option to improve erectile function. My name is Dr. Lisa Vuich. I'm the medical director and owner of Renew MediSpa, which I opened in 2005. I'm a clinical educator and master trainer for specialty med training for both aesthetic and sexual wellness procedures, and I'm board certified by the American Academy of Aesthetic Medicine. I've been involved in clinical research regarding the use of platelet-rich plasma therapies for sexual function, and I'm a member of a number of related medical societies. Renew MediSpa is located at 23B Crystal Avenue in Derry, New Hampshire. Now, when we speak about erectile dysfunction, we're talking about a very prevalent condition. It's estimated that 18 million or more men worldwide suffer from erectile dysfunction, and the incidence increases with age. By the age of 55, approximately half of men are affected, and as many as 70% of erectile dysfunction cases are likely due to vascular causes, which means low blood flow. Now, this results, of course, in a very high demand for treatment for erectile dysfunction. For example, as you see here, brand name Viagra has sales topping $2 billion in some years. You see a drop-off there in the graph only because generic formulations became available, but you can imagine that the overall sales of all of the different brands of ED meds are quite high. Now, we have a variety of options when it comes to erectile dysfunction meds. We have oral choices and also self-injection choices. These medications do not come without some complications. There are certainly side effects, there are cost concerns, there's the inconvenience of having to plan ahead or having to stop and inject. There are certainly men for whom these medications have an inadequate effect, or what we call treatment failures. And some men are on other medications which prohibit the use of these ED meds. Side effects commonly for oral medications include things like headache, flushing, GI upset, difficulty with vision like blurred vision or visual loss, stuffy or runny nose, muscle pain, and dizziness. And for the injectable forms, there are issues with penile pain, such as stinging and soreness at the site of injection, of course, potential for bruising, things like GI upset or changes in blood pressure and heart rate, and more serious things like scar formation causing curvature of the penis or even shortening of the penis. There's also some incidence of priapism, which is a prolonged erection lasting more than 4 hours, which is a medical emergency and has to be treated urgently. Now, we do have alternative procedures to the medications. These are procedures we've performed at Renew since at least 2015. We have, for example, the Priapus shot, also called the P-shot, which uses platelets that are obtained from your own blood drawn at the time of your procedure. And this platelet solution is then injected into the penis in order to promote better blood flow and better tissue health. The P-shot is safe, effective, and has minimal or no side effects, but does require maintenance injections, and certainly there are non-responders and partial responders as well. However, it's a very popular procedure, and as you can see here, for example, from the consumer site RealSelf, if you plug in the word P-shot, you'll find a 93% worth it rating, and other information like average cost, etc. So certainly the men who receive this treatment, at least those that comment on RealSelf, feel that it does help them. Another alternative procedure we've performed for the same amount of time is called Gainswave, or low-intensity shockwave therapy. This too is safe and effective with minimal or no side effects. The shockwaves actually improve blood supply to the penis and also aid with tissue regeneration. And we use the Storz Duolith device, which is pictured here, which is the exact type and brand of device used in many of the studies supporting this treatment. It's a comfortable procedure, does not require even numbing cream when we use this type of focus device, but once again, it does require maintenance treatments, and there is the potential for non-responders or partial responders. Gainswave has been used for erectile dysfunction for quite a long time. The interest in it began, as you can see here, back in 2010. That's about when the study started looking at low-intensity shockwave therapy for ED. But this type of therapy, shockwave therapy, has actually been used for decades across many medical specialties and for many different clinical indications. It's just that it's been in the last 13 years or so that there's been so much interest in shockwave therapy for erectile dysfunction. The P-shot also has been the subject of numerous studies. Again, interest started about 2009, 2010, and continues to increase with more and more studies being done. Unfortunately, the results of these studies are often difficult to interpret and compare because there's been a lack of standardization in things like which PRP kit was used and also what platelet dose was delivered, which is dependent on how much blood was drawn, etc. So although studies are there, it's again hard to compare them or draw overall conclusions because they're set up so differently. However, we know from our experience at Renew that it does work very well, and it's a very gratifying procedure to perform as it helps a lot of our male clients. So what is Botox? Well, Botox essentially is a made-up word. It refers to the use of Botox or botulinum toxin injection into the penis specifically for improvement in erectile function. It started out initially being investigated with rat studies, and then there were subsequent human studies, and these have been conducted in multiple countries. Erectile dysfunction is very often due, as I said, to a low blood flow state. So for erection to occur, it turns out that the muscle fibers of what are called the sinusoidal walls in the penis and the arterioles need to actually relax to allow maximal blood flow. And since we need to relax the muscle, that is essentially what Botox does. The question was, of course, would it be safe to do and would it be efficacious? In other words, would it work? Recently, actually last month, in June of 2023, this report was released, and this was probably what tipped me over the edge and convinced me to start to offer this procedure at Renew MediSpa. The report was titled The Safety and Effectiveness of Repeat Botulinum Toxin Intracavernosal Injections in Men with Erectile Dysfunction. Now, these men were unresponsive to approved pharmacologic treatments, and Dr. Giuliano here and his colleagues essentially did a retrospective review of patients they treated between 2017 and 2022. It was a total of 216 men with a mean age of 52, and a mean duration of their ED was about 5 years. Importantly, these men had been failing oral and injectable treatments, and that's why they were selected to receive the medication. They received either 100 units of Allergan brand Botox or 500 units of Dysport brand, or 100 units of Xeomin brand. And many of them had repeat injections over time. In fact, some of them had 7 or 8 injections over this period of multiple years. The soonest reinjection was at 5 months, and it seemed the median duration was approximately 9 months for most men, 9 months being the point when most of them were looking for a repeat injection. Importantly, there were no systemic side effects. And I want to point out again that this population in particular was what we call a difficult to treat population. You see in that little table in the lower left-hand side, over a third of them had severe ED despite the use of the medications that were already being tried. So they were very symptomatic. Now, what they found retrospectively is that the overall response rate was just over 77%. It was higher in men with milder symptoms and lower in men with severe symptoms of ED. However, interestingly, the response rate increased with repeat injections, and after the third and fourth injections, the response rate got as high as 94.7%, and I think that's really remarkable considering the patient population. Now, I'd like to point out here, the principal investigator, Dr. Giuliano, is very well known in the urology field. He's a urologist in France. He has extensive experience conducting clinical trials. He's a recognized authority on the study of male urology and sexual medicine. He's even co-founded a research lab called Pelvipharm, which investigates the pharmacologic mechanisms that control ejaculation, erectile function, female sexual and lower urinary tract functions. So he's widely published in peer-reviewed journals. He's edited and contributed to books. He's a member of multiple societies within the urology field. Now we move on to an actual clinical study, and this is exactly the type of study we'd like to see. A prospective, randomized, double-blind, placebo-controlled study. That means that when the study started, patients were randomized to one of 3 groups, and nobody, not the patients, not the physicians, knew what each individual subject was receiving. They were either getting one of 2 possible doses of medication, and then there was, of course, the placebo group, and no one knew if they were receiving placebo. They enrolled 176 men who were aged 40 to 70, and again, reminder, non-responders to traditional therapy. When they looked at the 3 groups, there was no difference between them in their testosterone scores or what other comorbid diseases they had going on, such as diabetes, heart disease, hypertension, high cholesterol, etc. These men were followed for 6 months, and they were not allowed to use any other medications for their ED. What they found was that with one of these doses, either 50 or 100 units, 40% of these difficult-to-treat patients were able to resume sexual activity. They found a highly statistically significant improvement within 2 weeks of injection and zero response in the placebo group. The maximum response was at 3 months, with no difference between the doses at that point. However, the higher dose group did better at 6 months. No systemic side effects, no complications from their treatment. Another study published in 2022 looked at the long-term effectiveness and safety of this injection as an add-on therapy once again to either injection or to oral medication. This looked at comparing Botox 100 units to Dysport 250 units or Dysport 500 units. These researchers noted that it didn't matter if a man had had a prostatectomy or not in terms of his response, and it didn't seem to matter the brand of the Botox used in terms of getting the response. However, the severity of the erectile dysfunction at the start did affect the success rate. They once again found that higher doses lasted longer, and I'll also point out that this study also was Dr. Giuliano, and that the only side effects were mild penile pain on injection in one patient and mild penile pain for 3 days following injection in one other patient. There were no systemic, meaning distant, side effects reported, and they state that there was improved erectile function for at least 6 months in 41% of the patients with ED of varying etiologies, and they felt the treatment was quite safe. So let's move on to some question and answer. What are the potential adverse events one might imagine with this type of injection? Well, of course, because it is an injection, it's certainly possible to have some brief injection site discomfort and possibly get a bruise. It's possible, as we've discussed, to have a failure to achieve the desired effect. What has not been reported in these studies are any more serious effects, such as distant spread, distant effect of the tox in some other body area, or any incidence of prolonged sustained erection, which is called priapism, which, as I mentioned, would require medical intervention. Additional limitations are that more clinical studies, of course, have been suggested to more fully evaluate things like what's the most effective dose. Is there a difference one brand to another at any given dose? So this really, in general, should be considered still a new frontier in ED therapy. We don't know all there is to know, and we certainly look forward to seeing the reports of more studies. And as I've mentioned, all of these existing studies are looking at groups of men who've been treatment resistant or treatment failures. We don't have, unfortunately, any studies in men who are doing well on already approved ED drugs like Viagra or Caverject or Trimix. So in other words, we don't have studies in men who are doing well with what they're doing, but would like to switch over, perhaps, to this injection, let's say for convenience, for something long-lasting, for something where they don't have to inject themselves every time or take a pill every time in order to have sex. Another limitation, at least for us here at Renew, we want to make sure that we express that we are not functioning as your primary care provider. We are not urologists. And if you're suffering from erectile dysfunction and you have not already been evaluated by your PCP or by a urologist, you may certainly want to consider having that urologic evaluation, perhaps having something like a penile Doppler, which is a penile ultrasound, for diagnosis and documentation of what's going on. That is not a service that we can provide. We also don't bill insurance. This isn't something, to my knowledge, that would be covered by insurance anyway, but we certainly want to be clear about that. Another question, of course, that would come up would be about brand. There are currently 5 different brands of quote-unquote Botox or botulinum toxin available on the market. There is the original Allergan Botox Cosmetic on the left. We no longer carry that one at Renew. The next one that came out was Xeomin. We tend to have some of that on hand, but our most popular, to be honest, are Dysport, Jeuveau, and Daxxify. Now, Daxxify you might not have heard of because it came out in late 2022. This is what we refer to as the double duration tox, the one that can last twice as long for a lot of people than the other brands. It happens to be the only one made in the USA, the only one with no human or animal byproducts, and the only one with a special peptide technology that essentially allows the tox to bind very quickly and very strongly, which is what gives, for most patients or many patients, a double duration of their result. Now, I've noted on this slide the different doses that have been seen in the literature, the 50 or 100 units of the Botox, the 100 of the Xeomin. The Dysport units, again, those are different, 250 or 500. And then the other two, I've put red question marks because those two in particular, I have not seen studies go up testing those brands with this particular indication. The units between the different toxins are technically not interchangeable, so don't put too much emphasis on those numbers per se. They don't mean weak or stronger. They're just they're proprietary numbers, and they can't really honestly be compared. We do also want to make it clear here that although these are all FDA-approved prescription medications, the use of any of these medications to enhance erectile function is considered off-label use. Now, physicians are certainly free to use medications for off-label indications, but we just want to be clear that the FDA has not evaluated specifically these studies or haven't officially completed evaluation. I don't personally know if any studies have been submitted to the FDA for this indication, but certainly the FDA has not given its thumbs up for this medication in this particular usage. Next question, what if it doesn't work? Well, based on reports from my colleagues who are in the field and have already been doing this, they tell me that if the initial dose doesn't work, an additional dose can be administered, and that may actually tip men over into a treatment success. So you can re-inject with additional units if the first dose selected is not sufficient. So as with, other uses of Botox, one dose does not fit all. Something may need to be adjusted if the initial dose chosen does not produce the desired effect. We do know from the studies, as I mentioned, that higher doses are going to have a tendency, within reason, to last longer. And we also want to make it clear that this isn't going to replace necessarily a recommendation for combination therapy, especially for men who have very significant erectile dysfunction. None of the studies that I showed you did the Botox penile injection along with platelet-rich plasma or along with Gainswave treatments. They only looked at the result of injection alone. So it's quite possible that if we start combining the Botox injection with other alternative therapies, we may achieve even higher success rates, even in men who are very, very symptomatic. Next, what about performance enhancement? Well, there have been no clinical studies published involving men without erectile dysfunction receiving the Botox procedure for performance enhancement. I'm sure it's happening. I'm sure it will happen in the future. I'm sure we'll be fine offering it to men who are interested in exploring this possibility, but we want to be honest and say we cannot point to published clinical studies in this healthy population. Essentially, the procedure will be less than 45 minutes, and a lot of that is you just sitting around. We do apply a prescription-grade numbing cream that sits on for about 20 minutes. While that's happening, we will mix up whichever brand we're going to use. We have to put sterile saline in the vial with the powder in order to be able to inject it. When we're ready to inject, we'll put on what's called a penile lasso at the base of the penis. This is not uncomfortable, it's not painful. We'll disinfect the skin with an alcohol wipe, and we will do this small volume injection into a total of 4 sites. There'll be 2 injection sites per side along the shaft of the penis, and then we'll leave that lasso in place for about 15 minutes. So the actual injection procedure is a minute or less, and all of the rest of the time really is either just preparation or waiting around for numbing or waiting around with the lasso on post-procedure. Now, I will mention that the lasso, there's been some debate as to whether that's even necessary. We're planning to do it for now simply because, that's what has been done. But, by comparison, it's been pointed out, we inject, the face with 100 units or more of tox on a routine basis, and we certainly don't put lassos around people's necks worrying that the tox is going to go somewhere else. So, you could make the case for it's not necessary, but for now, we'll stick with that as the protocol. It is what's currently being recommended, but it just may be that down the road that will be determined to be unnecessary. Now, I want to make the case again, we may recommend combination therapy. The more significant the ED, the more likely it will be that combination therapy will be recommended. That might be combining the tox with the P-shot. And if the tox is being done with the P-shot, it actually can go just right in the syringe with the PRP, so it wouldn't be any more injections than the P-shot itself. On the other hand, if we're doing shockwave therapy with the Gainswave device, our Storz device, then we'll go ahead and do the shockwave treatment, then put the numbing cream on, and then do the injection, so no problem. And finally, of course, general recommendations: healthy exercise routine, healthy diet, healthy weight, certainly no smoking, because that really contributes very heavily to erectile dysfunction by narrowing the blood vessels. Many men benefit from the use of a penis pump to also train the blood flow of the penis, so those are still very useful. And we recommend a nitric oxide boosting supplement, such as the one we carry at Renew called Affirm, which has a number of clinical studies showing benefit. Nitric oxide is a key player in the pathway to erection, so it's important to make sure you have enough nitric oxide around in order to maximize your erection response. So what to expect if you decide to come in for a consult? We call this a sexual wellness consult. You might meet with Victor, one of my RNs. The RN will go over with you a medical history form. We do some function questionnaires. These are essentially question and answer surveys, multiple choice, that allow us to basically document the symptom severity based on your answers to the questions. All of that would be reviewed by me, and I would discuss with Victor or whomever which procedure or procedures we recommend. We would decide on a dose and a brand, and you would go ahead and schedule your procedure, and then we would repeat those functional questionnaires, most likely at 3 months and 6 months post-injection, to see how you're doing. I hope this information has been helpful to you. We're happy to answer any further questions you may have. You can find out more information at our website, www.renewmedispa.com, or give us a call at 603-931-4345. On our website, you can also start a live chat, and even if it's after hours, we will get back to that chat message as soon as we're back in the medical spa. We offer consultations Monday through Saturday, and we have evening hours as well. Thank you so much for your attention. I wish you good health.